cardiac care. Introducing a breakthrough for complex coronary cases, a proud milestone for Karnataka and beyond. Uh, Complex coronary case means, most of the people know that blocks. Blocks are like, it is in the pipes. In your house, you have electricity, you have plumbing lines. When we talk about blocks, we are talking about plumbing line. When we talk about arrhythmias, which say heart rate is very fast, heart rate is very slow, then we are talking about electricity. So this is most of the people who have heart attack, they will be having some blocks in the coronaries. That is a blood vessels of what is called coronaries. So this is a milestone, is a breakthrough of the complex coronary. What is complex coronary means? You might have heard of blocks. That is, you might have heard for a long time. And here, that is a single block, multiple block. When we say complex coronaries, it means blocks in such a way that you can't manage with ordinary angioplasty or stenting. That is called complex coronary. Traditionally, these cases are routinely referred for bypass surgery. If we can't, see, there are two group of sets of treatment. One is without surgery, one is with surgery. Those, we are cardiologists, we do management without surgery. But surgeons open the heart and correct it. But these are the complex cases we usually refer to cardiac surgeons. But now, we can do by ourselves. Challenging cases demand extraordinary solution. Increase in calcified and long-standing coronary blocks. See, most of the long-standing multiple blocks having calcium in the block. And many people are asking me, if I eat more calcium content food, will it cause calcium more in the blocks? It's not like that. Calcium can be deposited over a period of years. When you are more and more aged, the deposition of calcium is more. When the calcium deposit is more, ordinary angioplasty and stenting will be difficult. Even if you do, the long-term result will not be good. And the complications are more. That is why these calcific lesions, we need more further refined treatment. One of the refined treatment is, the most effective treatment is this. Limitations for conventional angioplasty. If there is a significant calcium, you can't even pass a wire. You can't pass even a balloon for me to put a stent. So what we do is usually we send for surgery, or we use some techniques like rotablation or orbital atherectomy or IVL sort of cases. That is very, very costly. Need for a precise, minimally invasive alternative. So many of the patients nowadays, nobody wants surgery. The moment you say surgery, the patient will run away. They will go to Ayurveda, they will go to other modalities of treatment and all. They don't want surgery. So if he says, somehow you put a stent, we have to convince them, listen here, these cases we cannot put a stent. Just now also I had a patient. That is a doctor's father. And doctor said, sir, somehow you put a stent. He said, see, these things are very complex cases. I cannot put a stent. But these are the complex cases now by the use of laser. Certain, it's not all cases, but many of the cases we can deal with these complex cases can be dealt with angioplasty. And in the world now, only one laser system is coming. This laser system is not new. It comes in 1995. I remember 1998, I was in Apollo Hospital in Chennai. There they used this laser, but the patient had one table the patient died because of the perforation. So that time it is come, the laser treatment is come, because that time only people are thinking how to remove this calcium, how to make it more effective in the stent placement. But now that recently it is come back, it is revisited actually, by using a very minute, very thin, only 0.9 mm catheter. So you can easily go to the heart vessels, that is called coronaries, so that you will get a very good result. And Philips is the one system which is now presently doing this. Next time is the newer